Hi friends, today I would like to discuss you about homeopathic case taking. So it is a very important aspect of homeopathic practice. So someone said that good case taking is a half work done. So friends, but I think we people are not following the Master Hahnemann's guideline about the case taking. So what are his guidelines? Do we really understand it? Do we really follow him? No. We people are taking the case according to our own views, our own cultivated mind systems. Like we people are taking the very lengthy case takings, unnecessary conversations, unnecessary involvement in the patients, metaphorical meanings of terms, and we are running behind this. So many systems advises different type of own case taking methods. But friends, after doing this meticulous work of case taking, do we really think that what you want you get it? No. So friends, I face all these problems in my practice and I sort out it following the Samuel Hahnemann teachings. So that's why I am here to with you about sharing what are the problems I face and we are failing in the practice. Because of all these things, we are doing wrong type of case takings. We are not following the Master Hahnemann teachings regarding the case taking. What he advises us. Samuel Hahnemann's guidelines are very precise, very damn scientific, very clear factual approach. There is no any space for your empty speculations, your own demands. He clearly advises us in his organ of medicine, physicians' demands are not worthy while case taking, while selecting the remedy. मुझे ये लगता है, मैंने ये रिसर्च किया है, it's okay, you can do it, but it should not be a hypothetical, it should not be a imaginary. It has to be something proofs, it has to be precise, but it is not, and that's why most of our homeopaths are struggling to get a exact and best results in their practice, and naturally because of this they are not getting enough earnings, they are not confident enough to treat the patients. After all this case taking meticulous work, they find out there is nothing in the case and find out about the different systems only. They don't get any correct simillimum or any remedy about after the case taking. So friends, what are the Master Hahnemann's guidelines for case taking? He advises in the homeopathic case taking to you and all of us that every case is different. So your approach has to be individualistic. So what that individualistic approach he suggested to us. So according to the case, according to the pattern of disease. So if the case is acute type, if the case is chronic type, if the case is intermittent, periodical, or if the case is an intermittent fever, if the case is of one-sided, if the case is of emergency, in each and every case he advises us a different type of approach. For example, in the acute case, he will give a stress on acute exciting cause and the current picture of disease. In chronic disease, he advises us to discover the fundamental cause. So according to that, your questions has to be there. In the intermittent fever or intermittent periodical diseases, there has to be chances of mixed miasmatic cases. So another one-sided cases, there is a different approach, and each and every types of cases he advises a very individualistic approach to the cases, and he mentioned in the few of the aphorisms regarding this case taking. So I am not mentioning here the number of aphorisms, but I will suggest you the book, that is the Organ of Medicine. He clearly mentioned everything about the case taking pattern. Another thing what he advised us is a very important. What is that? So he advises to us the case taking should be in a patient's language only. So there is no any scope of your own interpretations. So why he advises us to take the history into the patient's language, his expressions, his narratives expressions, his friends expressions, your interpretations, your expressions are not helpful in selecting the remedy. That's why he advises us to case taking should be taken into the patient's language. So why he advises us? You has to be think over that. So friends, another thing he clearly mentions is that so while case taking, you should take the data very clearly, very precisely. You can't disturb the patient's chain of thoughts. Another important thing he advises us to during the case taking is so all the data should be maintained properly in each and every case. So don't consider ये मुझे लगा, ये मेरा observation था. What I feel is not important in any kind of case takings. So what the patient's demands, what the patient's morbid sensations. So he also advised to us you should be stressed onto the morbid altered sensations of the patients in the physical or in the mental conditions. But we people are focusing onto the normal behavioral and physical patterns of the patients. But friends, all these type of things never help us to in our practice, because we never get to or never reach to the simillimum because of all these things. And if we get down to the simillimum, it is unscientific. We don't have any proper proofs to show the science. So I am selecting the remedy on that basis. So friends, it is very difficult to focus or discuss or elaborate everything in this short video. So friends, I am Dr. Santosh Mahanawar, MD Homoeopath, and following the true teachings of Samuel Hahnemann, and my mission is to motivate to all the struggling homeopaths or to help the struggling homeopaths to make a difference in their practice, in their life. If you are following the Hahnemannian methods, so I guarantee you, it's my challenge to you, you get a drastic difference in your practice, you get a immediate difference in your practice, you get a good results in your practice. So friends, my advice is to all of you, so please follow my videos, share with your homeopathic friends, as my mission is to change the homeopathic scenario from different empty speculative theories, hypothetical theories, to the scientific Master Samuel Hahnemann Genuine Practical Homeopathy. Thank you.